Hey everyone, it's Dr. Martin. Welcome again to another Tuesday at Einstein Peds. Glad you could be with me. Really appreciate you being here, and hopefully you guys are all enjoying this finally beautiful day after a lot of rain. Do you want to go over? Super excited about today's show, but before we dive into the topic of choice today, which is potty training, I want to make a few reminders. One, at the bottom of the screen, you're going to see a link. That link gives permission to Facebook actually, to allow you to comment within our third-party app that allows me to do interviews called BeLive. Nothing else. Your email doesn't go anywhere else. It's just giving you permission or giving your permission to Facebook to connect these two apps so that you can actually comment in our live stream when I do interviews. So once you do it once, you won't need to do it again. But if you haven't done that, if you really want to ask questions during our live segment, then you're going to need to let us do that by granting your permission so that we can see those comments. A few things I wanted to go over with today. One thing I'm learning as we go as well. So it was an interesting article in NPR this week about face masks, and I thought I knew everything about face masks and the different types, and N95s and fitting and K95s, and learned something interesting. I've seen a lot of patients and family members wearing a mask that has a valve on it. So it turns out that's a one-way valve, which I didn't realize. And what that means is that, yes, it does offer protection from droplet spread of COVID. What it does unfortunately do, and why people like it, because they feel they can breathe a little easier, as you breathe out, a valve pops open, so that's the one-way part, and actually puts all those droplets back out into the air, and so it doesn't keep the large droplets in that we really want to do. So you can know where I'm going with this. So yes, it does protect you, but to the heck with everyone else, unfortunately. So really if you have one of those one-way valve masks, I would really recommend that you get something else. And it doesn't have to be fancy. This is where the cloth handkerchiefs and some of the stuff you're finding on Amazon, where it's just a cloth material, is fine. What we're trying to prevent are large droplets. If you're actually using an N95 or something that's more stringent in terms of what it allows through, those actually have to be fitted, because a lot of air escapes up the sides if they're not fitted correctly. So for those of us in the medical community, we actually go through a process called fit testing to make sure the seal is correct and the size is correct for us, so that smaller aerolized fine particulate droplets don't get through. And that's really critical. But again, one-way valves, don't recommend them. The other thing I did make, well, actually, he reached out to us, the head of the PTR at Fairfax, which I thought was some interesting information, and I just want to put out there. They've seen an increase in complications from a number of surgical things, particularly appendicitis. And that's largely thought to be because people are delaying going and seeking medical care. And so it was more than double rates of complications for appendicitis in the same time from last year, which they're largely attributing to people not coming in when the symptoms first start. So that's important to know. It's just a reminder again, if your child is having symptoms that are more significant pain, they're not able to walk, they're having high fevers, please reach out to us. We're open. We always have a provider on call. And in addition, if it's something truly more serious, I will tell you the ER, one, is not very busy, and two, they are doing extraordinary things to keep you safe. And I've actually had families comment to me on how pleasantly surprised and happy to find how safe things were in the emergency room. So I think in the beginning of COVID, you got a lot of impressions and pictures of New York City and places that really got overwhelmed, where people were sitting in waiting rooms for extended periods, and they really couldn't keep spacing and distancing, and didn't even have the materials for protective gear to protect patients and staff. That's not the case now, and definitely not the case at Inova Fairfax. I want to actually applaud what they've done. I will tell you, you're probably safer there than I've seen at some of the stores and restaurants where people are going right now, because of the extraordinary things that they're doing to keep you safe. So again, reach out to us if things come up. Don't delay it. It's not worth the risk, and we're starting to see those complications. And I hate it. It breaks my heart to see that. Wow. So today's show, I'm super, super excited. I want to remind everyone again, if you want to make comments in the stream where we can see them, particularly if you have questions for our expert today, I need you to okay Facebook by going to that link and saying it's okay for the two apps to connect. And that way your questions can appear in our live feed and we can answer them as we go. So without further ado, our guest today, someone many of you already probably know. She is what we've termed the unicorn of pediatrics. She's my first hire of providers when I started up the practice. She's a nurse practitioner trained out of Children's Hospital of Philadelphia. And for those who are not in the know, that is, May will tell you, the top program, but debatable, either number 1 or 2 top program for nurse practitioners in the country. She's also a local person who grew up in Northern Virginia and attended UVA undergrad as well, for those of you UVA alums out there. So May today will be joining us to talk about potty training, my least favorite, I'm not gonna lie, my least favorite topic, probably because I'm scarred by my experiences with my own daughter doing it. So I will say it's one of those anxiety-provoking topics for most parents. And lots of questions. I think it's a great example of another thing we do in parenting, that there's not one right path to success, and there's lots of different things you're going to hear about. You should do it this way or that way. And so that's why we had to bring in the best today. And so here she is, guys. Without further ado, Ms. May Peng. May Peng.
Hi, do you see me?
Not yet. Can you? Let's see. You should be up.
I see myself on a dual screen with you now.
There you go. Good. Okay. Because ironically, it's showing 2 pictures of me on my screen. So I'm hoping people are seeing too. So you can see yourself, May, on the double screen? Good.
I see both of us.
All right. So on that note, let's get started, May. I'm hoping, and I hope I didn't give you the hardest topic to talk about, because I actually personally find this very, very challenging to talk about. I've already gotten, I think, in the comments section when we announced the topic, people making comments about, knowing when to start. So I think that's a great place to start. Where do you think, or what would you advise for families when they should start potty training?
That's such a good question. So I usually recommend around anywhere starting at 18 to 24 months, but there's a couple of caveats. And the number one is readiness, right? The only reason is because I have spoke about this so much, and I don't know about you, Dr. Martin, but in the quarantine well visits that I'm seeing right now, everyone wants to master this. So I'm calling this our Poopies and the Potties Masterclass of 2020 Summer Edition at Einstein Pediatrics. So if your child lands around there in that age range, readiness is key. But usually what does readiness look like is the most common question, and I have several. It's the child who needs privacy, the one who scrolls to the corner and needs to drop a poop in the corner and needs some alone time. It's also the child who wants to help you out all the time. So that means mommy's done flushing or using the restroom, and you have baby boy Jules coming up and just wanting to help you flush that toilet right there. So readiness is actually the golden key for every family.
Yeah, it's funny. Isn't that the answer for like most things? Whether it's eating, it's sleep. It's kids give you signs of things. So I think I think the overriding theme of all this stuff is, what is your child doing? What are they? And they if you pay attention, it's like they give you the clues.
Yeah, they do. They do. And oftentimes they also squat. So they just try to copy you, or they might even verbalize it and said poop, and they hand you the diaper. That's a good green flag saying, I think this child's kind of ready. Well, why don't we try it? And there's no harm in trying.
No, I totally agree. And know that I think that's part of it too, is I think people are afraid, and that, and although sometimes see kids take a step backwards, but I think that's with most developmental things that happens. And it's, and that's not a failure, that's normal child development. And, 2 steps forward, 1 step back is pretty common in the developmental range of things that kids do, including potty training. Yeah.
I absolutely. And I think one parent actually told me that in their 2-year visit this week, they said, yeah, I'm going to give them a different name for HIPAA reasons and to protect that baby. But let's say Johnny was in the bath and they were just taking a bath and they accidentally pee. You're like, whoa, that's happening underneath a diaper this whole time? And when you have such a here's the thing I always tell my parents. I say, I want you to pee and poop in a diaper tonight. Imagine how uncomfortable that is. So let's reverse psychology. Remove that diaper. That poop is leaving your butt. It's a very different feeling. Just imagine for a second, you always pooped and it's kind of squirreling up there. It feels like you always had the control and now it's leaving you. And so I call it embracing the differences and the growing pains in life.
So true, May. And only you could put it that way.
As Dr. Martin calls me, I'm his unicorn.
Well, so let's go. I'm going to head over to, because people are like, all right, so my kid's showing signs. Do you have tips on how you approach families and like to start this process?
Yes, it's just like feeding, right? So everything's kind of universal in terms of starting things. You want to normalize it as a daily routine. That means make it a part of your bedtime routine, the bath routine. Sit on that toilet for a minute or two. Wake up in the morning, sit on it. Just as you would brush your teeth, sit on that toilet for a minute or two. And I say release the pressure a little bit, because the more you normalize it, the more you're relaxed to approaching it, the more the pelvic floor relaxes, and the more that they're likely to catch an accidental pee in the potties and the poo-poos in the toilet. And then you immediately reward that. With this said, I think it comes with a lot of pieces as well. And so a good starting point is morning and night. Just for a minute at this point. Get up, sit on that toilet for a minute or two, brush your teeth, and then at nighttime, before you're about to head down to bed in that bath, go ahead and sit on the toilet too. Whether or not they go and actually void or pee and poop in the toilet is not the true key. Is you're just trying to normalize that into a daily behavior so that when it does happen, it's not a shock and an abrupt change.
Yeah, no, that's awesome. So I think there's a couple things I would key on that I think are really important for people to hear. Normalization, right? You're normalizing this process. And you're seeing a lot of kids around this age wanting to do things that you're doing, right? And that becomes part of your normal. So bringing, the male child in with the dad when he's got to poop and pee to normalize that process. Books, right? That's part of the purpose of books. It's not only create the vocabulary and dialogue, but it's to normalize and let kids know. So I think normalization is like super, super important in anything we do. And then I like how you did routines, right? So you're hitting on the routine aspect of what we do. It's like, I can't, especially right now with COVID, there's nothing more important than routines for kids. And so you'll find just things go so much smoother if it's just part of this is just the way we do things. This is what we do every day. So I think that's super, super awesome.
Absolutely. And you actually mentioned, I don't mean to interrupt, you actually mentioned the book. And I'd love for people to look into this book. It's actually called, Where's the Poop? Where's the Poop? And I love it. And hey, you know what? Make it fun. When you make something rewarding, your child's actually going to embrace it some more. So why not cover it in a birthday wrap and say, I got a present for you. Let's open it. And I love this book because flappy books are way more fun. And this is actually a book called Where's the Poop, where there's different animals and they embrace, a tiger goes poop in a jungle, a kangaroo poops in the outback. Well, where's Timmy gonna poop? And you get to open it. And when you do that, it retains that information some more and actually makes it better applicable, and just swap it for a bedtime book. And when you see that the time approaching for potty training is coming, make it one of your bedtime books a couple of weeks beforehand and just normalize the behavior like Dr. Martin was saying.
Oh, that's awesome. So this is one of the things I love about this age. It's the magical thinking, because that's the book's even hitting on that. It's like, this is the age Santa Claus is real, the tooth fairy is real, everything. They're very concrete, but yes, there's this fantastical, and you have to be careful with how you say things to them because they will take you quite literally, but at the same time, you have a lot of fun with that. So there's Barbara Howard, I always mention, is a developmental pediatrician. Shout out to her out in Baltimore. She was involved with Chattis, which May will know, no one else will know, but it's
Hello? Are we frozen, guys?
needs to go to the party. Everyone wants a good party, and the only way for the poop to get to the party is go through the toilet. And so just that magic thinking in different ones, they find that that's like interesting to them, that catches their imagination, but stuff, and get excited when there's this sort of other thing going on, and it kind of distracts away from the tension of I want you to do this. Instead, it's getting buy-in from them and trying to achieve this other goal of getting the poop so that everyone can have a party and celebrate. So I mean, anyone can make up this stuff, right? It's like, so the more imagination you have with it, the more fun it is. But it's one of my favorite things about this age, though, definitely. So I did this next question, and I think really creates a challenge for a lot of us. So where I do see a lot of times people having problems with the potty training or steps back is the holding of poop is often and causing constipation. I think it's important for parents to look out for it. How do you, so give me your experience with it and like how you tend to handle that with families. Oh, May,
Hello?
I can't hear you. Yep, you're there.
Can you hear me? We got cut off. Intermission. Hope you got a snack. Could you repeat that question one more time?
Yeah, no problem. So I was saying, constipation is a common derailer of this process. And it's very common really from 3 to 6. We see a lot of kids holding stools, either because they're just, they're doing something else they're interested in, and they're distracted and they just hold it. They're not interested in using the potty at that time because they're engaged in what they're doing. How do you what tips or challenges with constipation and potty training have you experienced, and how would you advise parents on handling that?
I love that question. So I have one golden rule. I always say, hey, let's resolve the constipation before we try the potty training. Just because if your child's already struggling with a little bit of constipation, which, hello, toddler diet. I love everything beige. Give me carbs, give me Chick-fil-A all day, every day. I avoid all vegetables, goodbye. And that just hardens the stools a little bit. And that's a very common finding at the potty training age. With this said, I always start off with the basic underlining of constipation precautions. That means making sure that your child is not having hard stools before you do potty training. And if that is truly the case, okay, that's all right. Let's go ahead and encourage the pea fruits. You got the prunes, pears, plums, peaches, and would you look at that? It's summertime. Whole Foods has a bunch of that. You are in session to start your constipation treatment. Hydration is your other factor because we love to drink milk. Oh, I love milk. And making sure that your baby is drinking less than 18 ounces a day, backing off on that, encouraging more fluids. Buy that water bottle with Paw Patrol on it, with Hello Kitty on it. And it's actually really hot outside. So reminding them to drink water and stay hydrated and making it fun with a cool bottle is key with all that magical thinking in line. And movement. So get out there, get that gut motility going. And I bet you're going a little cabin fever anyway. So open the backyard door, put on that sunscreen, and go outside and get that gut motility going. And once you have those stools nice and soft, every once in a while, you might need a little bit of medical help. And that's when I actually have you guys phone call us and we'll talk about medications that can further soften the stool like Miralax. But I always say, hey, give me a phone call so we can walk you through these things. But I love to exhaust the primary standards before I jump to that result as an ultimate intervention. And once we have that going and the poops are soft, that's when I go ahead and start the potty training. But here's the one key. If you're already struggling with constipation and you have your potty training, you also have to make sure that you have the right devices. And one thing that Dr. Martin, I didn't even get to talk to you about, and I know I'm jumping ships already, is there are different modalities of pooping, right? So you have the seat cover, And then you have the porta potty one that you can kind of sit on as well. And so being mindful that the feet must be supported to support that pelvic floor and helping that relax. And a golden thing that many people don't think about is that bowel bladder movement occurs every single 2 hours after you drink water, after you eat your meal. So shoot for that time after the meals too, so that you can encourage that behavior a little bit better for your child.
Yeah, I think that's and I didn't mention, sorry, but where you are doing the poop in particular, right, becomes really, really important. A lot of kids have fears of sitting on that toilet. So I was graced with 2 kids who weren't, because I can't stand that little potty. It's disgusting. But let me tell you, if you're running into potty problems and that's the fix, it's a lot easier than other solutions. So it's sometimes just having something where their feet touch the ground, absolutely, or a stool where they can have their feet on the ground when they're doing. So there's sometimes a fear of falling in, and also just the coordination, like you said, of like getting that poop out, right, and being able to bear down. Yes. The other thing I liked you talked about is milk. Milk at this age is such a funny thing. Some kids hate it, and we struggle to get them to get their calcium in. Like we want them to have 2-3 servings of dairy a day for that. And then there's other kids that they would exist on that if they could, right? They love it. So I'm gonna enter my I promised at least one Lily story. So Lily has always been a milk fiend. And so one trick I have found with a lot of patients, not just my Lily, rather than fight these really determined kids that demand, and sometimes you have to, but sometimes it's easier to find workarounds. And so she would, if you had given her, I just had another kid the other day with the same thing, taking about 35 to 40 ounces a day of milk, which is way too much, right? 16 to 26 ounces a day, or 24 ounces a day is really the sweet spot. And so, but you can water it down. So rather than tell them no more, which is hard to do at that age, just watering it, don't let them see you do it. That's the trick. And they think they're getting just as much, but when in fact they're getting actually a lot more water than milk. And that often is a good trick to do, but man, can milk derail? And I just had one last week, 40 ounces a day. They didn't realize it until we started dealing with the constipation. So it happens quite frequently and can really derail your potty training.
It really does. I don't blame them. Milk is good. Yeah.
So pee withholding. Some kids just refuse. Can you imagine, May? Kids don't do what we tell them to. I like, when does that happen? My kids always do what I tell them to.
I'm running to the bathroom in between visits. I don't know how they do this. Those kids are resilient. Let's just put it there. I love pee withholding. It kind of tells you their personality too. And you promised a Lily story, so I'm going to piggy off of that. That Lily's a very strong personality. So we might have several patients who are just like her, and that's okay. We need some of those strong personalities in this world. I know quite a few of our own patients like that. Pee withholding. So I mentioned a little bit about the changes in how, because wearing a diaper is not a lifelong skill, hopefully not until we're 90 at least. And so with this said, having that sensation of everything leave your body, and also that scary factor that Dr. Martin mentioned, it's very daunting for something just to go inside a hole when you're sitting on it and you've always been supported, right? And you're sitting in this hole all of a sudden, like you could fall into it. And so anxiety can be a factor as well, where they're fearful and they just clench down and they're not relaxed and they hold the pee until you do something like you put them in a bath and you notice they're in their regular environment and they're relaxing. There's also that sound that you hear with the water in the background, and they finally just release it. There are several tips with that. So I mentioned one already. So A, make it a regular routine. You're trying to relax the pelvic floor. B, run some background noise. Turn on the sink water, turn on the bath water, so that they're familiar with that noise as well. It almost acts like a white noise too when you're sleeping. It comforts you. And then the third thing is, I actually recently learned this. So here's a fun fact. I raised all 5 of my cousins, who are all girls, and I had to potty train them because no one wanted any more diapers to do because they just flung out everywhere. And so there's a bubble trick that you can do. So when you make it a part of your daily routine, I call it the bubble trick. And you can sit on the toilet, you aim for that 1 hour after dinner and having you load them up with fluids, a lot of water, whatever they're drinking at dinner. Sit them down and let's blow bubbles, because that way you're bearing pressure down on the bladder and you release. Play a trumpet, play the flute. So there's a lot of ways to help release that pee that they're trying to hold on to, and also helps them have some fun with it. But ultimately, for both potty, pee-pee, and poo-poo training, rewards are key, because kids love rewards. And I have one golden saying. I say rewards must be exclusive, consistent, and immediate. So it's only when they pee can they get that reward. And guys, I don't have deep pockets, and I bet you don't either. We're not giving an iPad every time you pee at this point. So give some stickers. And Dr. Martin actually shared with me in the very beginning of my training. He's like, go to the dollar store and just rate it. Get all the stamps, get all the toys, get the tiny things. They'll never know that it's $1. It'll be a big reward to them. And reward that moment, but don't reward it for everything. It's exclusive to the potty training. It's very consistent, and it has to be concrete and immediate. So then they attach that reward to that behavior. And who doesn't want to play with bubbles?
Yeah, no, and I'll take that one step further. What we actually did was we let the kids pick out. Woo! So they actually, and so it was like, they were like, it was like Christmas every time, right? But they were small things, very, very small and very cheap. And I think that's important too, because what I see is like sometimes an escalation. It's like, well, once you give that one thing once, it may not be worth it next time once. And we've all experienced that as parents, is it's like getting the same thing over and over. Eventually the novelty of it wears off. At that age particularly. And so you do have to be creative. The other thing it's really useful I found is, sometimes it's you get some time with something. And I don't mean just iPads. It could be with a toy or something that they really like or want to use, or you play, or it's an activity they get to do with you that's like meaningful or important to them. And not that I want to withhold activities, but like having a special activity that they get to do for 5 or 10 minutes. Again, not iPad, not electronics, but something else that they like. And then the only other thing I would bring up is and I guess I'm going to ask you, May. I'll ask you.
Oh goodness.
I'll put you on the spot. Oh, what about food as a reward, which is a common one with candy, and M&Ms is a common one. What's your advice on that?
That's so good. So I always have edible, tangible, and non-tangible rewards. And edible does fall into that category, but I'm sneaky with it. I'm sneaky with many things here. So that means we get a popsicle, but mama and dada made that popsicle with a bunch of spinach and some peanut butter and a dash of yogurt in there, and maybe even some raspberries in there. Little did you know it's a high fiber popsicle, and that's a reward. And it happens to be 90 degrees today. I bet you want to do that. So replace that. Do some oatmeal cookies instead. And make them a part of this process. And you want to say, oh, we made the cookies. I'm going to put these as a reward for later. I call them pee-pee cookies at that point. So absolutely, you just have to be innovative with it, because too much sugar, the teeth, I don't want cavities. Yeah. What about you, Dr. Martin? How do you do that?
It's funny. So I have mostly moved away because, I think the psychology of it is, right, we don't want food necessarily to be thought of as a reward. It's a need. And so there's this undertone that if we use food as a reward for things, and there's some research on it, that you're eating for things other than hunger becomes problematic, right? And I'm not going to lie, I actually did it. It was a last resort with Lily. Sorry, Lily. Someday she's gonna look back at these videos and be like, why does my father always use me as an example? But yeah, so I did it. It was the one thing we got to work was small food rewards, but I don't know if I did it again, I might have done it different. I think I might have been more creative, but in the end it worked. But just based on the research that I see, so I generally would put it as last resort. If you can do non-edible things, I think I probably would stick to that. But, sometimes, that's the textbook and we all live in the real world. I don't think I've ruined Lily for having used that, and she's potty trained. So, and I think that's a lesson for all. I mean, it's like there's the ideal, and then there's the real world as parenting. And man, sometimes you just
gotta make it work.
You just make it work sometimes, and you break some rules and on the way. So,
and I might chime off of that. I love what you just said. I think what you said was true. And one thing I always remind parents, I'm like, make sure it's not a bribe. All right. It's always a reward. We're always validating. It's never punitive, and it's a learning process for them. And know that one reassuring line I always have my parents, I say, hey, when they get to preschool, there's also that little social pressure that occurs, and that kind of mobilizes them forward too. So it's not the end all if you can't get it by a certain age. It's a growing process. And I say, embrace the mess.
Yeah. No, and this is a message to all those parents out there. You are not a failure when things go well at daycare and they come home and they don't do the same thing for you.
Got it.
That goes with potty training. There's a different set of circumstances there. And I always tell you, it's just like, unfortunately, with our loved ones that we know they're going to be there, we push them more, right? We do that with our husbands and wives. And we kind of unleash more of our internal thoughts and things, as you say. And so they just, it's a different environment, and there's more peer pressure, and there's more feelings that, that you do want to not alienate yourself from your peers and these people that take care of you temporarily during the day. So it's just a different environment. So don't same thing happens with eating. Like, they will eat better at daycare than they will coming home. I will say, I do tell parents, if things are working drastically different, definitely reach out to them and see what they're doing. And you can employ those same techniques at home. In fact, that's great for consistency. So I've cheated. I've taken daycare. I'm like, how did you get her to do that? And it's like, I'm like, I didn't think of that. Let me do that.
Just
and
like
it works.
naps.
Yeah. So I think that's great advice.
Yeah.
Well, so I've been told that it's important to let my staff eat lunch. So I'm going to draw this to an end, May, and let you off the hook, because we could probably rap about this for a really long time, because there's lots and lots of questions.
Sure thing.
But definitely maybe we'll come back and revisit this at a later date too. But want to say thank you for being here.
Thank you.
I didn't give her a choice.
I want a raisin cookies.
There's advantages to being the boss. I'll give you a reward. Yeah, absolutely. I'll get you a cookie.
Thank you for having me.
No, thanks a lot, May. All right, take care. All right, guys. Well, I know we probably didn't answer only a fraction. We probably only answered a fraction of your questions about this. And if you weren't able to make this and you're not seeing this slide, know that you can definitely ask those questions in the comment section under the video. We will continue to monitor that and answer questions there. And obviously, you can reach us, right? So if you have things that are very specific to your child that you want to discuss, the portal is a good starting place. I will say with potty training, it can get complicated, and those things like constipation and some behavioral challenges can present themselves with this. And so sometimes we have to do those in person, or even sometimes telehealth is a way. But sometimes it takes more than what we can do in the portal, but it's a good starting place. And so sometimes, I'll be honest, sometimes there are very simple questions I can answer there, and we'll do everything we can to try to answer it there. And if not, we'll set something up where we can go through this stuff. We're here for you for this as a topic. This is part of what we do, and pediatrics covers a lot, right? But don't get frustrated. That's my big thing. Sometimes you got to take a timeout. Sometimes we need a timeout. And if you're getting really, really frustrated with the process, it's okay to take a step back. So one more Lily story. I can tell you my daughter weaponized potty training to a point where when we would try to put her on timeout, she would look you in the eyes and say no, and on demand poop on the floor. So there are definitely some challenges that come up with potty training. For all of us. And I can tell you, I had to open some books and get some advice with her. But sometimes you just have to take a time out. Sometimes you just take a step back, and we're going to take a step back from potty training when there's too much tension, stress on you as a parent and on them as a child. It's better to take a step back so you can take 2 steps forward. And remember, again, there's no perfect way. There's no perfect parent. There's no perfect person. We all go into this doing the best we can. And you just got to stick to it. When you need help, we're here for you. And so on that note, I want to close and say, have a great week. Stay safe, keep wearing your face mask, keep, definitely a social distancing you should continue to adhere to. And we are here as questions come up and we get closer to school. I know there's going to be more questions. Make sure you stay up to date with your vaccines, with your well checks. We're doing a lot to make the office safe. We're actually planning into the fall now to figure out how to make everyone safe during flu season. So get your flu vaccines when they get here as well. And until next week, be safe and have a great week, guys. All right, take care.